Welcome viewers. I am Dr. G.P. Dash, Director of Mousumi Hospital and Principal of National Institute of Medical Science. Today we shall discuss about the last part, that is the fourth part of the kidney ultrasound. Sometimes it becomes very difficult to differentiate a stone with the vascular reflections. Sometimes the vessels looks like stone when it jointly appears. So few things if you mark, then you can easily distinguish between stone and the vascular reflections. Normal calcified vessels are most notable cause of internal bright echo reflector. Normal vessel right angle should be right angle. You see here in this picture, they are in the right angle and may appear small and bright reflective spikes are there. In predictable location, and you know the anatomy of the kidney, so you will find them in the predictable location, not like stone. Stone can be got anywhere. In recognizable pattern, and pattern would be the C. Patterns are very definite patterns. Patterns are very definite. So this allows the identification of stone and the vascular reflection. What you see in this picture, by color Doppler you can see this. These are visible tiny threads like echogenicity. They are medullary pyramids. In this picture you see, what you see in this picture, pyramid projects into the minor calyx and also appear echogenic, and medullary nephrocalcinosis. This is prominent pyramids. Like absent many things in our congenital absence of many organs in our body, congenitally may be absent. Kidney also may be absent. If it is in unilateral, then the patient can survive. It is bilateral, it is compatible for the life. So baby will die in mother's womb. If it is unilateral, it is more in left side, and bilateral absent kidney, I told, it is incompatible to the life, to the newborn, will not survive after the birth. If it is unilateral, the other kidney will have a compensatory dilatation. It will be hypertrophy, and this may give due to absent kidney on the other side. What you see in this picture, this is duplex collection system. The degree of duplication generally varies man to man. It may range from duplication only in the renal pelvis to complete duplication of the ureter. The duplex kidney shows the hyperechoic renal sinus separated by the hypoechoic area of renal parenchyma. Here. And referred as the built collection system. The duplex kidney is usually enlarged. The possible way to diagnose the complete duplication of ureter and ultrasound by observing two ureteric jets on the same side. What you look in this picture, a horseshoe kidney, horseshoe type. This is fusion abnormalities of kidney. Two kidney fused. This is the commoner form. There is improper absence and malrotation. The kidney is closer to the spine. Here it is spine. Kidney is closer to the spine, fused to one lower pole, which are medially rotated. The isthmus connecting the two poles appears hypoechoic area and may stimulate much lesion. Due to such abnormality, may arise when the lower pole of the kidney cannot be sharply outlined. What you see in this picture, a very long elongated kidney. Here the kidney is fused, two kidney is fused, cross-fused ectopia. Here fused kidney lies in one side of the abdomen. An ultrasound picture is unusually long solitary kidney with two separate sets of sinus. You will see two separate sets of sinus. By this you can understand it is a cross-fused ectopia. What you see in this picture, this type of thing is present in the young adults, those who have anemia and salt loss, polyuria, increased blood urea. Later it develops to the renal failure. Here ultrasound shows the renal sinus area. The reason is the multiple small microscopic cysts. Here these are the reason is small microscopic cyst present within the medulla. And the lumen of the cyst being small cannot be seen separately. And being small cannot be seen so separately, closely placed bright walls match the echogenicity of renal sinus. The reason is that the multiple small microscopic cysts present within the medulla, the lumen of the cyst being small and cannot be seen, closely placed bright walls match to the echogenicity of renal sinus, producing the apparent prominent sinuses. Differential diagnosis of medullary cystic disease you can do with the medullary sponge kidney. Now come to the medullary sponge kidney. What you see in this picture, this is the condition where the collecting tubules within the medulla are dilated and observe closely increased parenchymal echogenicity due to small cyst when the calcium is not present or due to calcium deposit. Clinically, patients are usually asymptomatic. In 10 to 20%, calcium deposits may form within or adherent to the dilated tubules. Nephrocalcinosis. These stones produce increased echogenicity of the renal parenchyma and may or may not cause the acoustic shadowing depending on their size. Size is big, then there will be shadowing. If size is small, there will not be any shadowing. Here you see two echogenic kidney. This is infantile polycystic disease. It is autosomal recessive disease and present in the uterofetus. This disease is incompatible to the life. One obstetrical ultrasound bilateral hyperechoic kidney are seen with the oligohydramnios. This kidney at birth will be seen as extremely enlarged bright kidneys due to hepatic fibrosis, which is usually associated with child will soon develop portal hypertension and renal failure eventually develop. What you see in this picture, lots of cysts inside the kidney. This is multicystic kidney. It is usually unilateral disease. When bilateral, it is incompatible to life. The other side may show an abnormality, most commonly uteropelvic junction obstruction. The disease is characterized by the enlarged kidney with the cystic area. This cystic area may be similar in size to adult polycystic kidney disease. However, significant difference is there between two. Multicystic kidney is eventually unilateral, and the polycystic kidney is generally bilateral. Remember this thing. Now we have come to the last part of our slides. This is renal failure. Kidney of ARF may appear normal. Kidney may, you can see normal on ultrasound. When ultrasound changes appear, they are usually increased cortical echo. Here you see the increased cortical echo. So friends, we have come at the end of this video. I hope you have liked the video. If you have liked the video, please give a like. And if you are new, then subscribe and push the bell button such that I can bring such informative video, teaching video to you very soon. If you want to take admission, we are teaching kidney. We are teaching ultrasound in our institute. I myself, I shall teach you this. You can take admission in a very small amount of money. You can learn ultrasound. If you do ultrasound also, then also you need to come here to learn the thing. Because here you will get such things which, if you have done ultrasound for 10-20 years, after that also, it may be something you are missing, but you do not know. Okay, hope to see you in the next class. Until then, bye-bye.